Hello, everybody. Thank you so much for being here with us today. Welcome. We're just letting people in and we'll get started in just a minute.
Can you hear me?
Hi, CJ. Yeah, we
Yeah.
can hear you.
Oh, perfect.
Wonderful. Okay. Well, it's 2 o'clock, so I think we'll get started. Hello, everybody. A very warm welcome to today's Global Book Club session. We are absolutely delighted to be joined by Professor Julia Downing, and we're going to be delving into her book, Children's Palliative Nursing Care. Julia is the Chief Executive for the International Children's Palliative Care Network and has over 30 years of experience in developing palliative care for children and adults around the world. We're also joined by three, maybe two at the moment, actually, two of our wonderful Challenges Committee members, Shazia and CJ. Hopefully, Andres will be joining us a little bit later, and they're going to help us as we delve into the key themes in Julia's book. Now, you may be wondering why we're wearing these hats. Well, today is Hats On for Children's Palliative Care Day. And I'm going to let Julia tell you a little bit more about that. So without further ado, Julia, over to you.
Thank you very much. And I'm just going to share my screen. So if you can tell me when you can see the presentation. Okay? Great. So yes, I'm Julia. I'm the Chief Executive of the International Children's Palliative Care Network, otherwise known as ICPCN. And I'm very pleased to be with you all here today. It's just a bit of an introduction to the book and also to Hats On for Children's Palliative Care Day. And if you look out on social media for the hashtag Hats On for CPC, you will see that we've had people from all over the world joining in our Global Awareness Day for Children's Palliative Care. So why children's palliative care? Well, there's children like this young girl around the world who need access to palliative care. And sadly, not all of them can access it. And we know that there is wide variation of access to children's palliative care. And I think one of the things behind the book was that certainly at ICPCN, we believe that children's palliative care should be available for all children with life-limiting, life-threatening conditions and their families from diagnosis throughout the course of the illness, wherever and in whichever country they are being cared for. And so our work at ICPCN is to bring together people within our network and to support the development of children's palliative care around the world. Because we know that there are millions of children and their families globally who can't access palliative care, and so they're suffering in pain and with other symptoms because they can't access palliative care. Studies showed that there were over 21 million children needing palliative care, and only up to 10% of those can access it. So over 19 million children around the world who need palliative care who can't access it. And we also know that there is the greatest need in low middle income countries, but we also know that there is inequity all around us. Every country has inequity. I was at a meeting earlier, last week in the UK, looking at who are the children we're missing and how can we reach out to them. So we must improve access to palliative care around the world, in our country, in our place of work, wherever we are working. And so how can we do this? Because we mustn't stop until every child has access to the palliative care that they need. And to just give you a bit of an example, this was back in 2013, and we've been mapping children's palliative care progress over the last 20 years. And the darker green, then the more developed and the more integrated children's palliative care is within that country. So this was back in 2013. And in 2023, you can see there's been some improvements, but we still have a long way to go to turn this map dark green and to increase access to children's palliative care. So ICPCN is doing that, or trying to do that. We're a network with the global network of individuals and organizations working together. There's over 7,000 individual and over 600 organizational members. Do please join us. It's free to join. But we believe that every child and young person and their families has the right to access palliative care. That palliative care should begin at diagnosis, or for many of our children before diagnosis. Some will never get a diagnosis and continues into bereavement. The family are the primary caregivers and need to be empowered, and this is key for the book that we're going to be discussing today. And that children's palliative care is about life and living life to the full. Often people think it's just about death. End of life care is an important component, but it's all about life. It's enabling children and the young and their families to have the best possible quality of life. And so we have our annual Hats On for Children's Palliative Care Day. It's the second Friday of October. Tomorrow is the Global World Hospice and Palliative Care Day, but today we focus on the children. And it's an awareness campaign, encouraging people to wear hats, to have fun, perhaps to put on fundraisers for their organizations, just raising the profile of children's palliative care, getting the media involved. One of my colleagues always walks through their big referral hospital with a bright hat on, and everybody's asking them why the hat, and it's their opportunity to talk about the need for children's palliative care. And we encourage people to upload photos to social media, obviously with permission, and share hashtag Hats On for CPC, trying to raise awareness about the need for children's palliative care. And so that, I think, brings us on to the book, Children's Palliative Nursing Care. And we know that throughout human existence, children have died. And yet children's palliative care is a relatively new field in many countries. It hasn't been the focus of education, publications, research, but things are changing. There's a lot of interest in the World Health Organization. We have a World Health Organization palliative care working group. We've brought the International Council of Nurses and other nursing teams into that working group. And we have just approved a global advocacy campaign for children's palliative care over the next year. So there's a lot more interest in children's palliative care. And importantly, there was a gap. We wanted to have a book written by nurses for nurses, and not just by nurses from one part of the world. All of the chapters in this book are co-written by nurses from high-income countries, low-income countries, from Asia, from Latin America, from the UK, because we wanted to hear that global voice. And we wanted a book that addresses issues across the world, but also one that recognized the importance of the public health approach to care. We need to empower families. We need to empower communities to provide care. And we'd also, as a team, written a position paper on children's palliative care and public health. So we wanted to link in with that. So both our position paper and the textbook were published at the beginning of this year. So some work done on education framework in the UK identified 4 levels of need for education: at the public health level, at the universal level, at the core and the specialist level. So really recognizing that children's palliative care is a public health issue, and aspects such as social attitudes to death and dying and bereavement need to be explored. And we need to think about how we can use the public health approach to providing children's palliative care. So the book is divided into 3 sections. The first section is addressing issues around universal and public health, the second around the core level of competencies, and the third around the specialist level of competencies, and really focusing on nursing. So we're looking at compassionate communities, beliefs, attitudes and values, public perceptions. We're looking at delivery of unwanted news, self-care, play, education, symptoms, end of life and bereavement. But we're also looking at how do we manage as nurses complexity? How do we design, deliver, and evaluate education? What about leadership? How do we evaluate the quality of the care that is being provided, and research readiness and leadership? And we're looking at 3 chapters, I think this areas around 3 chapters, the ones in green, building and sustaining compassionate communities, delivery of unwanted news, and leadership for improvement. So I was asked what some of the key messages were, and that's quite hard because hopefully we've got lots of key messages. But some of the overarching key messages that we believe that nurses have a key role in the delivery of children's palliative care. They have important skills and knowledge in children's palliative care that are needed across the board in terms of health provision. But the public health approach is essential. If we're going to increase access to all children and their families, then the public health approach is one way that we can do this. Our attitudes, beliefs, and values impact the care. So if we think children's palliative care is only end-of-life care, then we will only focus it on end-of-life care rather than on the full spectrum of palliative care. We also need to promote a positive culture of care. We need to think about how we communicate some of these challenging issues. And we need to see the provision of children's palliative care within the context of our culture and society as a whole. Obviously, we think it's really important that we have a skillful and competent nursing workforce, and that our nurses need to invest in their well-being. It's key. We cannot provide palliative care if we're not caring for ourselves. It's also, we reflect that component that many of the children, when asked what is important to them, they want to be normal. Whatever is normal for them, they want to be able to see their friends, to go to school. How can we enable that? How can we enable them to be within their community? Importance of managing complexity. And then those specialist skills are also key around leading education, leading research, being a leader, leading evaluation. So in a few words, some of the key messages from this book. I think just as I close this bit before we get into the questions from our colleagues, when we were writing this, we want it to be helpful and informative. As we say here, it seems inappropriate to say that people will enjoy the book, but we hope that you will find it helpful. And also to recognize that we are all scarred by palliative care, and we accept these scars. We bear them for all the children and the carers that we have been caring for during some of the most difficult times. But what we do hope is that this book informs and empowers nursing care, because we believe nurses are the people who make the big difference, who can really help children to experience childhood and to facilitate good deaths and good lives, and enhancing the memories and bereavement of those who remain. So as nurses, we felt it's really important to have a book written by nurses, for nurses, and written by nurses from around the world to try and take into account some of the different perspectives and resources available. Thank you.
Oh, thank you so much for that, Julia. What a wonderful introduction to your book. As I mentioned before, we are very lucky to be joined by 3 members of our Challenges Committee who have all read Julia's wonderful book and have prepared some questions for her. So we're going to start with Shazia. Shazia, over to you.
Thank you, Hannah. Good afternoon, everyone. My name is Shazia Ali, and I'm the hub lead for the Eastern Mediterranean Region Nursing Now Challenge Committee. First of all, I think I would say it's a huge privilege to get a chance to read the wonderful book by Professor Julia on children palliative care. And the chapter on building and sustaining compassionate communities has some of the great insights on the public health approach to palliative care. And engaging nurses in building compassionate communities, I think, is a great step to connect the dots between community and healthcare for better accessibility. So my question from Professor Julia is, what are your thoughts on our current nursing enforcement and empowerment in this area of public health approach, and what gaps in policy and education can be improved for a better implementation? Thank you.
Thank you very much. And just to say that I was just one of 3 editors and one of many authors, so privileged to edit this book, but it was a real group effort. So what are my thoughts on our current nursing enforcement and leadership empowerment in the area of public health approach, and what are the gaps? I think what's happened over the years, certainly in many countries, is we've medicalized death too much, and we've medicalized death and dying. And so the pendulum, if you like, has swung from not being medicalized at all to being very medicalized, and we need to kind of bring it back into the center. We need to think about children and their families in the context of the community in which they live, in the context of the society and the culture in which they live. And so we need to approach this from a community perspective, from a public health perspective, not so much from the specialist perspective, although obviously it all goes hand in hand. But we need to try and support the public, and we support communities and families to empower them to really be able to enable the children and their families to live in the communities, to be at home, and to be surrounded by the community, to have a less of a medicalized focus. It's not so much enforcement, I think, but it's empowerment. So we need to empower nurses to think differently. I remember that one of the first modules that I actually did when I did my degree in nursing was actually around the community and the needs of the community and finding out what the community wanted. And that was so important because too often our healthcare is focused around us as health professionals. We work 9 till 5, so therefore we provide a service 9 till 5. But we talk in palliative care about it being focused around the child and their family. So how can we do that? How can we empower nurses to think differently? We don't have to do everything, but we can empower the families to do that. We need to think outside the box. And as nurses, we need to be trained to think outside the box. And I was talking to some people last week and saying, actually, we have to be disruptors. We have to think about how differently we can do things. Because if we want to reach all those children around the world, then we need to do that within that public health approach, by empowering the communities and the families. There aren't enough of us to go around, even if we wanted to. So we need to develop education with different aims, with different focus. And research has shown that the benefit. So we need research to show the benefit, and some research has already shown the benefit of a public health approach. Abel and Kelleher, 2 key people who've written about public health approach in palliative care, say that palliative care is a collective responsibility. It becomes a matter of societal concern. So let's not take it all upon us as nurses as our sole responsibility or within the professional team, but empowering the families and the communities.
Thank you so much, Julia and Shazia, for your wonderful question. Next, we're going to hand over to CJ for his question.
Hi everyone, I'm CJ Nwasike. I'm a member of Nursing Now, and I'm a mental health nurse by background. I also work as a policy researcher for a health think tank as well. And yeah, it's a really great book. I'm really happy to be here. And the chapter, the section that I'm going to be looking at is about leadership, palliative care, like leadership and improvement. And the question that I had was about the WHO strategic directions, as well as the state of nursing reports. They provide really good reflections as well as a framework. And in your experience, Dr. Julia, which four pillars in the WHO strategic direction, whether that's education, jobs, leadership, or service delivery, is the most challenging to implement in children's palliative care, and why?
Okay, so my first thought on that was you want me to pick just one of those, because they're all so interlinked, and they all have different challenges. But I think if there's one that I would like to focus on to try and overcome challenges with, it would probably be that of developing leaders, because I believe that if we can develop our nursing leaders, if we can develop children's palliative care nursing leaders, then they will work with together and through their advocacy to influence perhaps the education and the jobs and service delivery. But they are all so interlinked. One of the challenges we often have, because children's palliative care is relatively new in many countries, there often aren't positions for nurses. And so we see nurses having to provide palliative care in their own time. So we need the jobs. We need the education, because we need the education on children's palliative care. Sadly, it's not included in everybody's initial training program. So we need education. And obviously we need nurses to provide the service delivery. But as we raise up leaders, and as we raise up nursing leaders who are able to vocalize and talk and advocate for children's palliative care, who are prepared to put their hands up and be counted, who get a seat at the table and can influence policy, then that will influence many of the other areas. I think one of our challenges is probably not quite so specific to children's palliative care, but in many cases, we need to try and raise the profile and raise leadership in nursing generally. I have been in meetings where I have been the most senior person there, but as soon as the doctors have heard that I'm a nurse, they have literally turned their back on me. We need to raise the profile of nursing. And as we raise leaders across nursing, and then we raise leaders within children's palliative care, then we will have an impact, hopefully, on education, jobs, and service delivery. So that's why it's exciting hearing about the work that you're doing in policy and having sessions like this and the work with Nursing Now, with young nurse leaders, because it's leadership that is so key, so that we have a voice. And I think part of this book was wanting nurses to have a voice about nursing and about children's palliative care. So I'd go for leadership.
Thank you.
Amazing, thank you. I know our Challenges Committee members have more questions for you, Julia, but I think let's go through everyone and then we'll loop back. So Andres, over to you.
Hi, Professor Julia.
Hi.
Okay, well, this is Andres. I'm from Barcelona, Spain. I'm the regional hub lead from the Europe's region. And I really like how they prepared those questions to focus on the management perspective or on policy action. But I would like to go more with personal perspectives. So just one question to begin with. I would like to ask you, from your personal experience, when do you think nurses should tell to the child what's happening to him, what's happening to them? So when do you think they should know about the pathology, they should know about the treatment, about the prognosis? When do you think that should happen? Or should we tell them something? Should we tell them anything, or just the parents? How could we approach that topic from your personal experience?
Okay, thank you very much. And this is something that we're always being asked. And I think this is one of the things that many healthcare professionals, many nurses really find difficult, and are kind of almost afraid as to what to say and when to say it, fearing how it will be received, fearing perhaps that we've got a lack of skill or experience. In children's palliative care, when asked about this, and often when asked about symptom control, we often say it depends. which can appear unhelpful, but it really does depend on a range of things here, a range of factors. So both the physical and cognitive age of the child or the young person. So what is their understanding? What is their cognitive ability? We know as well a child's sort of experience of illness. So young people who have been who've got a chronic condition and have been unwell since birth have a very different understanding from a young person of a similar age who has been fit and healthy, never had anything to do with hospitals, and then suddenly gets cancer. So their experience and their illness history is really important. What their parents, caregivers think, again, depending on their age, what questions they are asking, what are they wanting to know? So there's lots of factors. And I think one of the key things for me is, as a nurse, is that I will never lie to a child. Now, that doesn't mean to say, if they say, am I dying? I say yes. Not like that. But I will never lie to a child, because as soon as you lie to a child, then you will lose their trust. The other thing is that children often understand a lot more than we give them the benefit for. They pick up cues. If they're in hospitals, they see other children. There's also challenges for culture and cultural norms. Who is the decision maker? Who should be given information? What do you do when the parents say, we don't want this, we don't want our daughter to know, and yet the child is asking questions, and some of the collusion there. So there are many different challenges here. But let me just give you 2 examples. So we had a girl, she was about 10 and she had cancer, and she was an inpatient on the ward, and it was an open ward. This was in Uganda, and the child in the bed next to her died overnight. And the next day, she asked everybody who came onto the ward, whether they were cleaners, nurses, doctors, whoever, she asked what had happened to the child in the bed next to them. And we eventually we went to her and asked her why she was asking everybody. And she said to us, I'm asking because I want to know who I can trust to tell me the truth when I want answers. And that was a 10-year-old girl. And she knew exactly what had happened. And she wanted to know who would be prepared to talk to her about that. On another occasion, we had a young boy, and he again was on the ward, and we gave him some ice cream for lunch, and didn't think anything of it. And then about half an hour later, he asked if he was dying. He asked my colleague if he was dying. And when she explored with him why he'd asked that, he said, because you gave me ice cream for lunch. And the boy in the bed over there, you gave him ice cream and then he died. So I thought I only got ice cream because I was dying. So, you know, sometimes, so we have to explore with children and young people what they're actually asking, what their understanding is, what is behind their questioning. And, you know, if a child is being treated in a cancer ward, they will probably pick up the fact that they've got cancer. So it is about, there's no one answer. If it's appropriate, then yes, I think it's important to talk to the child about what's going on. We will find that many of them will know. We did a study many years ago asking children and young people what they knew about their illness and asking their caregivers. And we found on several occasions that the caregivers said they don't know that they've got HIV and that they're dying. And the children or the young person was saying, I know I've got HIV, but my parents don't know that I know. And so what you find often is that there's this kind of collusion, and they both know, but they're not speaking. And actually the literature suggests that if you can help them to, where appropriate, to talk about that, then that is so much more helpful. So I haven't given you an easy answer, but it's about getting to understand the child, where they're coming from, what they know, the cues that you're getting from them as to what they're asking. And then if a parent says to me, I don't want my child to know, I will say to them that I won't bring it up. But if their child brings it up to me, then I won't lie, and I will probably suggest that we meet and have a discussion with their parents and we talk about it together. But it's an important thing, something that people are worried about, and where there's no easy answer. Some children and young people don't ask. Some don't want to know. Others want to know all the details.
Oh my goodness, I can't imagine how hard those conversations must be.
You know what? They're challenging. They're challenging. And even now, I've worked in children's palliative care for many years. I always kind of find it challenging because I want to respect all involved, and I want to, be respectful.
Yeah, that must be so difficult. And as you say, Julia, it takes time to get to know the child and their family, and like you say, what they're asking and why they're asking it, and find the right approach for them. It's so personalized.
Yeah.
When you've already got so much else that you're juggling as a nurse, I imagine I'm not a nurse. I imagine that must be incredibly challenging.
And that's why we talk about, people think palliative care is literally just the end of life. Well, if we get referred to a child and their family like a day before they die, we don't have time to build up that relationship. We don't have time to find out what they want to know and what they know. Whereas if we see the children and their family early on, even if we then don't see them for months, and then see them again when they need it, at least we've got more of a picture, and we've perhaps got a bit more of a relationship, because relationships are key in this.
That makes total sense. Shazia, I want to come back to you to ask your second question to Julia.
Thank you, Hannah. Yeah, so the discussion is so amazing and engaging. And my second question would be related to, again, the community-oriented approach to palliative care, Professor Julia. Is the children palliative care is indeed a critical aspect of care because of the fact that, children are being socially, mentally, physically challenged by the disease process. And here we are, with the idea of bringing a public health approach so that we can, take a better care, a better palliative care of the children and their families. And our idea, as you discussed, is, we are training community members, to care for the palliative care children. So my question is how we will make sure that the trained community members that we are preparing are going to provide the expected, care for the palliative care children. As in healthcare, when the nurses or any healthcare professionals are being trained for the palliative care program, they're getting an enormous, an extensive training, being on the pathophysiological process of the disease or the, care aspect of the disease. But training the community professionals or the members is, is a huge task, and how you're going to make sure that, they would provide the expected care and that they will, benefit the palliative care population, children population.
Thank you. That's really important, and I think too that actually wherever we're providing palliative care, whether it's in the hospital or in the community, and whoever is providing it, we do need to be evaluating. My hat's falling over my eyes. We do need to be evaluating the care that we're giving. We need to be finding out, are we enabling the families? Are we enabling them to live the normal life as much as they can? And are we still providing good clinical care? We need to think about it in the holistic nature. And I think also importantly, when we're looking at evaluating the care, we need to be measuring what is important to the child and their family. So one of the challenges in children's palliative care and research, but also in clinical care, is that up until now, there hasn't been a validated outcome measure for measuring the outcomes in children's palliative care. And that children's palliative outcome scale is being finalized, and it's being trialed in many different countries now. Interestingly, it was first done developed across sub-Saharan Africa. So it's a great example of where the search from across regions from sub-Saharan Africa has then fed into research all over the world. But it's, yeah, how do we measure? And I think anywhere there is variability and inconsistency, even in a palliative care unit with all of us as nurses, some of us do things differently to others. Sometimes we provide good care, sometimes we don't provide as good as care as we want. So we do need to look at evaluation and monitoring what's going on. We do need to support the community volunteers or ASHA workers or whoever it is that is providing that support. And one of the things that we often find is that everybody's asking these community volunteers to do things. So they've got training on recognizing when someone's going into labor, then they've got training on inoculations, and they've got training on palliative care, so how do we recognize what is appropriate for them? And importantly, how do we make sure that they know how to contact us, who to liaise with if there are challenges, and if they feel out of their depth? But we do need to make sure that the care being provided through the public health approach is child and childhood centered, that it's safe, that it's effective, that it's timely, that it's sustainable, and that it's just and equitable so that people have access to what is needed. So we need to think about, what do we want to evaluate? Why are we evaluating it? For whom? Making sure that it's culturally sensitive and context specific in our evaluation, and making sure we're measuring what is important to the child and their family. But it's key that we, in all care, in all children's palliative care, that we are reviewing the outcomes of the care and the quality of the care, and what can we do differently. That's important.
Thank you, Julia. CJ, did you have another question?
Yes, and I think you've kind of touched on this in drips and drabs, but I just wanted to. My second question was around so over the next 5 to 10 years, what would you say would be the single most effective important change that you would like to see in children's palliative care or policy? Because I know in the book it touched on various facets like gender empowerment and also, and when I say gender empowerment, so more female leaders being in positions of power where they can influence that change. Also, a lot of different countries are scaling up at different paces.
Mm-hmm.
So I know obviously there's some work that you've done in Uganda around improving and implementing some of that framework, but it would just be interesting, just from your reflections, what you think would be a good stepping stone, because I know that it's a bit difficult to pick one, but if you were to
But you're going to make me pick one anyway.
Sorry.
I think one of the most important changes would be that children's palliative care is seen as an integral part of pediatric healthcare, because too often we are having to fight for it. And going back, I guess, a bit to only being referred people in the very last few days of life. If it was just seen as a normal part of healthcare, then some of the fears about well, we can't mention palliative care to the child and their family because they'll know that they're dying. You know, some of those fears will have gone away, because if it's just an accepted part, integrated into our normal healthcare, it's not seen as an optional extra, then that would make such a big difference to children and their families. Too often, it is still seen as an optional extra. Often people think, oh, children's palliative care, cancer care. Yes, but cancer is just a small component of the broader children's palliative care. But even in cancer care, you know, some places, every time a child is diagnosed with cancer, they will meet with the palliative care team at that diagnosis, so that the family know that they are there and can be supportive. They might not see them again for a while, or ever, but it's part and parcel of the care, the package of care that they get, rather than being seen as an optional extra. So if the policy of integration was really implemented, that would make a big difference to families. Also integrated into education programs, into policy. Again, we're often having to fight for children's palliative care in the undergraduate curriculum because there's only so much time. So yeah, integration throughout.
Thank you, Julia and CJ. And last but not least, back to Andres.
Yeah. Okay. This is my second question. I would like to mention that when I started to be interested in research, my first topic was palliative care. Hannah knows that. And I was very, very interested in palliative care, and I started to do some things about bioethics and palliative care. So that's why when Hannah told us that there was going to be a webinar about this topic, I didn't hesitate to join the topic.
Great.
And I asked her to be one of the speakers. So yeah, they are asking some questions more involved with policy, etc., which is something that I love because I'm doing a PhD related to healthcare management, etc., and policy and policies, etc. But I like the personal perspective. So again, I would like to ask you from your personal experience about this. Although we are sometimes, well, people used to let us know that we should have empathy with our patients. And although we are told that we should have empathy with our patients, at the same time, we are also told that we should leave what happens in the hospital at the hospital. But what happens with children? Is it the same with them? Should we really have real empathy with them, going beyond our schedule? Should we approach them in a different way as we approach adults? I don't know if you get the idea of where I'm trying to ask you.
Yeah,
but they are more vulnerable.
They're more vulnerable, and sort of perhaps emotional involvement as well is always a
should we do an
thing.
exception with them?
So again, I would say it depends, but I think our challenge is, if we're working in children's palliative care, is that we have more than one child and family to care for, and we are their nurses. We're not their parents or family, which sounds simple, but it's actually quite important. And that might sound harsh, but we've got to look after ourselves. If we're going to provide care, children's palliative care repeatedly, we have to look after ourselves. But we're also humans. We also have emotions. And some children will touch us more than others, for whatever reason. And I think to say that we have to just leave everything at the hospital and not get emotionally involved at all, I think that is difficult. And if we do that, I wonder if we're actually caring with compassion and showing that compassion and that care. Now, I've always said, this is, you asked for my personal, so I've always said for myself that the day I'm caring for a child who dies and I don't feel it here in my heart, the day I don't feel it, I leave palliative care, because of it's the loss of a life, it's the loss of a child. Now, I don't mean that I'm crying uncontrollably and that the parents are comforting me. No, not that at all. But if I don't feel it, then I've become too hard to it. That's for me personally. But that means, and I think in my presentation just now, I talked about how we're all scarred by palliative care. And we do bear that. And so that's why I think we need to really look at self-care. And actually, when you look at the book, we talk about communication and then we talk about self-care before we talk about symptom management and other things. Because knowing that children's palliative care is emotional, we have to look after ourselves. And if we don't look after ourselves, then we can't provide the care. But we have to get that balance between showing empathy and care and compassion and blocking ourselves off from it completely and being too hard. Does that make sense? And it's different for all of us.
Totally.
As I said, the day I don't feel it, when a child dies, I leave children's palliative care, because then I will have become too hard to it. It's a difficult one, you know. Yes, leave what stays at the hospital, but doesn't always happen, particularly when you're caring for a child who maybe is the same age as one of your children, or maybe goes to the same school as one of your children. It's not easy. So I recognize that I will feel emotion, but I have to look after myself.
Thank you for your answer. Very accurate, and I really like the way you approach it.
Thank you.
Oh, thank you all for these incredibly, insightful questions. It's been really wonderful to listen to you all. We've got about 10 minutes left. So I'd like to open up the opportunity for our participants today to ask any questions that they may have. I think there's a couple in the chat box already, but please feel free to unmute yourself and put your hand up and ask your question to Julia if you would like to do so. Just looking in the chat box now. I did see a hand up before. Was it Asma? Did you have a question?
Terry from India had a question.
Ah, perfect.
Yes, in India, the public health approach is not strongly reflected in undergraduate and postgraduate nursing curriculum. We have community health nursing, but that is different. It focuses more on clinical work at community level rather than community participation and empowering communities. How do we address this gap? So that is one of our challenges. How do we make sure that there is a public health approach within our education and training? And that would benefit not just children's palliative care, but a wide range of things as we think about society, as we think about community, culture, and we think about healthcare. I think I said that I was at a meeting last week in the UK it was actually specifically looking at bereavement and grief and who were they missing. And it wasn't until they got involved more with the community and understood the way that the community worked and who was important within the community, how could they actually meet those needs. So somehow we need to try and get public health into the curriculum. But as I said earlier, often these curriculum are really squashed. They've got so much. And usually if you say to somebody, well, we need to add this to the curriculum, then they say, well, what will we take out? So it is about showing the value not just for palliative care, not just for children's palliative care, and building that perhaps within that community based training, and try and get them to think differently about it, about involving that public health approach. It's a rethink. We have to rethink if we're going to reach everybody. And I mean, in India, the number of people you have, if we're going to reach everybody, we have to do it through a public health approach. Otherwise, we're not going to. So, yeah.
Thank you, Julia. I think there's a couple more comments, and then there's a very specific question. How can we deal with child in bone marrow transplant in crucial phase? I don't know.
How can you deal with child in bone marrow transplant? Well, this is, I guess, this is another setting. I mean, I can't go into detail about the actual clinical care because that wouldn't be, I haven't got time and it wouldn't be right now. But I think things like transplant, whether it's bone marrow transplant or whether it's organ transplant, you know, you never know which way it's going to go. It could go either way. And so it's really important to have that dual approach. So having the palliative care team involved as well as a transplant team. One of the things we often say in children's palliative care is we hope for the best, but prepare for the worst. So hoping that the transplant will work and that the side effects won't be too bad. Then we're hoping for that. But let's plan as well for what if the side effects become too unbearable. How can we manage? What if the transplant doesn't take? How can we support you? So it's often having these dual things together, and it's interesting because often you find families can actually hold those two things together. So even if not with a transplant, even with a child perhaps with cancer who's relapsed on treatment and has relapsed whatever, and the families are still hoping for a cure, then they can be hoping for a cure, but at the same time you can be working with them for, okay, we all hope that there'll be a cure. But I wonder if there isn't, how would you like us to care for you and your child? So it's that thing of holding two things together. And sometimes people will come to you and say, oh, so-and-so's this child's parents, they really don't understand that the child is dying because they were talking about hoping that they'll get married in a few years' time. But they do. But it's that dual thing of holding those two things together. So that is key in the work in palliative care. It's actually being able to hold those two things together.
Thank you, Julia. I can't see any more questions, but if anybody would like to ask one, please, now's your chance. Feel free to unmute yourself. Yes, Terry from India.
Yes, this is just a follow-up question on my previous question, and thank you for that answer. Um, uh, when it comes to public health approach, I see only two groups actively engaging in doing it. One is public health professionals, and specifically palliative care professionals who are practicing community-based approach. Are there any other groups with whom we can partner with to expand this public health approach, especially for pediatric palliative care?
So I think there are a wide range of groups, but obviously in different parts of the world and even in different parts of India, you have very different. But if we think about the public health and the types of things that are done through a more traditional public health approach like sanitation or immunizations or whatever, you know, there's people who have been working within a public health environment and that approach for many years. So we can learn from them and we can work with them. And then we can pool resources as well. and we can get further together. So yeah, I think, you know, one of the things that we need to do is to look in our communities and say, okay, who is there? Who is working within a similar field? It might be different, but similar field. And how can we build on that? You know, in some parts of India, you've got the compassionate communities within palliative care and Kerala and places, which are really, really strong and really good demonstrations of that community coming together and that public health approach. So yeah, it's important that we look around to see who we can work with and who we can learn from, to strengthen our advocacy, to strengthen our reach, and to strengthen our the public health approach for children's palliative care. It's interesting because it's been talked about public health approach for palliative care generally, but up until recently, there hasn't been a lot of talk about public health approach for children's palliative care. And so that's really something that we are trying to strengthen.
Thank you, Prof. Shazia.
I can hear somebody. I heard somebody. And was somebody else?
We have a student who's a student of a master's in public health nursing.
Yeah.
So that is great. So how can public health nurses contribute to research that improves access and quality of children's palliative care? Well, I mean, this is something where I think, a bit like Terry was just saying, we need to draw to join forces and to work with you and your expertise in public health and with our expertise in children's palliative care, and learn together from that. You're talking about research specifically to improve access and quality, public health research, using your knowledge and skills of that and ours in terms of children's palliative care. So really working together as public health and children's palliative care professionals to see how we can implement, to see how we can evaluate, to see how we can do that research that demonstrates that that it works, and that it's sustainable, and that quality of care is there. So yeah, I think that's really important.
Amazing. Oh, thank you all ever so much for joining us today. Oh, we've got one more hand up. Okay, yeah, last question. Andrew.
Yes, mine is not really a question, but it's just a small comment. We find that children palliative care, children start with their parents at home, which means they already know that these are our children and they know exactly where they are. We are coming in as nurses to help these parents to understand the children much more and to make sure that we help them to persevere and be with their children during this time. So we need to do a lot of health education in a community around, so that as we discuss, the community will really understand and they will know much more about their children, even when they are sick. Since the palliative care starts right from the diagnosis. From there, we'll be able to journey and reach our goals. Even if you wanted to do a research and all, the beginning always starts from our own parents, the parents of the children and the guardians of the children, so that we can focus ahead. And that's why now we talk of public health palliative care. So just a comment.
Yeah, and one of the things that the WHO and their conceptual model for palliative care development, they have the empowered people and communities as the foundation for the ongoing development of palliative care services. So yeah, empowered families and communities are key.
What a brilliant place to close our book club session this afternoon. I think we could go on and on for the rest of the day. It's been such an interesting conversation. Thank you. A huge thanks to Professor Julia Downing for joining us today, and to the wonderful members of our Challenges Committee who have prepared such amazing questions and helped us kind of go through the key themes and topics in this book. It's truly fascinating, and thank you to you all for being here with us this afternoon. Stay tuned. I'm sure we will be having another Global Book Club session coming soon, certainly before the end of the year. The recording of this session will be shared on our YouTube channel later today. And if anybody isn't already a member of the Nursing Now Challenge, please do join us. We are a global community of student and early career nurses and midwives that exists really to support our members, providing them with leadership development opportunities. So I really hope to hear from you, as many of you as possible. And yeah, stay in touch and have a wonderful weekend. And many, many thanks again